in evaluation. My name is Amina Ali, and I'm a principal consultant at MPC, and I'll be chairing the webinar this afternoon. And again, thank you everyone for joining us and making time to explore this topic. We've got a great panel of speakers coming up, but I'll be introducing them in turn a little bit later on. As you're joining, you'll probably see this welcome slide posted for you here, and it just has a few bits of information that you need to make note of, but I'll just recap some of these as we go. The first thing is, please do take a chance to introduce yourself, your role, what organisation you're from, and where you're dialing into Zoom from today. If you'd like, you can also share a few bits of information about what interested you in this topic or any aspects you're particularly keen for us to cover today in today's discussion. I guess a few last bits as a quick reminder of the format for today's webinar. We'll have 10-minute presentations from each of our 3 speakers. We'll pause between each speaker for a brief Q&A. So if you have any clarification questions about what was spoken about, please do post these in the chat. And make sure you have everyone selected so that everybody else can see the questions that you've posted. I also wanted to share a few general ground rules for today's conversation. Please do change your screen name so that it shows your name and your organisation if you're coming from a particular organisation. You can turn live transcriptions on or off by clicking live transcription in the bottom panel and show hide subtitle. And just for your information, this event is being recorded. It's also worth noting that we're going to be sending you a follow-up email tomorrow with some additional resources, including some post-event feedback surveys, which we hope you'll be able to fill in. And I do want to take a moment to thank the Cloth Workers Company for the programme of work. MPC and the Cloth Workers Company have been collaborating on trusteeship webinars since 2010. And this seminar is really a key pillar in supporting Cloth Workers' wider objective of improving charity governance. Lastly, I'm sure many of you will be on Twitter. If you are, the event hashtag for today is #NPC Trusteeship, and you can find us at NPC Thinks. You'll see the hashtag on the welcome slide as well, in case you forget it. I also want to mention briefly that today it's a public event, obviously, so as ever, you might find that there are journalists present in the audience. So I'm just going to give it maybe another minute, and then I'll move on to introducing the topic in a bit more detail. Great, I can see plenty of you are introducing yourself in the chat, which is brilliant. Okay, so I'll move on to the introduction to the topic. So obviously we're talking about diversity, equity and inclusion today, and I thought I'd pick up on why we thought this was a particularly important conversation to be having. So the scope and purpose of evaluation is really continuing to evolve over the years. There's been increased attention in charities given to how evaluation informs the design of interventions, to having really responsive and adaptive approaches to evaluation throughout project life cycles, particularly in response to the pandemic, and to creating evidence-informed strategy and policy. However, I've really noticed that, over time, less attention has really been paid to how the way data is collected and used operates, with really unacknowledged biases that can be misrepresentative, they can be exclusionary, and they can help to kind of further disadvantage marginalized groups. So thinking about what does DEI mean in an evaluation context, we'll obviously be hearing from our speakers today, but as a starting point, to me, it means evaluation that's culturally responsive, that's participatory, where there's a focus on equity and awareness of the influence of really systematic biases and inequalities on outcomes. Unfortunately, these approaches aren't still, the norm in evaluation practice, but I'm hoping that we'll, be generating in our discussion today some thoughts and ideas about both why it's important and about what can be done to further this. So in terms of more about why MPC in particular wanted to focus on this topic, I'd say at MPC, our goal is really to transform the social sector through research, guidance, and debates, so that we have an increased positive impact on how the sector helps the people that need it most. We do find that MPC, like most of our speakers for today's webinars and much of the audience, I'm sure, are in a position to either be hearing directly from people that are affected by these issues and by communities that are affected by these issues, or be steering the direction of how evidence is used in organisations, or furthermore, influencing organisational strategy and policy. So I think given the influence and the responsibility that we have, it's really clear that we can be doing much more to be advocating for diversity, equity, and inclusion in evaluation. I wanted to talk to you a bit about a new initiative that MPC is involved in that strongly relates to this topic. We're actually partnering with some other organisations such as the Charity Evaluation Working Group and the Social Investment Consultancy to really explore how the sector can advance thinking and practice on more equitable evaluation practice in the UK social sector. We're approaching this as a collective model. The working title at the minute is the Equitable Evaluation Collective. This work has been highly influenced by the EEI, who are based in the USA, and the Equitable Evaluation Framework that they've developed, which some of you might have come across before. And really what we're trying to do through the EEC's work, although it's very much in the early stages, is by collaborating, we're aiming to influence, to generate energy and momentum, and to try and really build a community of practice around this work. Although it's still very developmental, we're discussing with interested stakeholders how we can best resource this upcoming collective work and how we might be able to kind of move the conversation forward. If you are interested in learning more about the work that we're doing with EEC, in the follow-up email that gets sent out tomorrow, we'll include a contact form, so you can kind of let us know if you'd like to be added to an email list to be kept informed of how this work develops. Right. So hopefully everyone that's planning to join us this evening has done so. So I might, in just a moment, be moving on to introducing our first speaker for this evening. So I'm delighted to introduce Lisa Raftery. Lisa has over 20 years of experience working across the charitable and public sectors. Lisa is also a trustee for the Rosa Fund, who are the only UK funder dedicated to resourcing women and girls organisations that are tackling gender equality. Lisa also works as head of grants at the Social Investment Business, which is a social investment charity that funds charities and social enterprises to help improve sustainability and resilience. Prior to this, Lisa's also been a grant manager for Ending Women's Homelessness Fund at the Homelessness Link. And she'll be talking to us today, obviously on the topic of DI in evaluation and why, in particular, why it's so important. And over to you, Lisa.
Thanks very much, Amina. Hello, everyone, all 90 of you. Please do continue to introduce yourselves in the chat, just whilst I'm waiting for my slides to appear. I'm going to sort of talk you through a bit of an overview about Rosa. I'm coming to you here mainly as a trustee for Rosa, but I will be drawing on other experience as well as I work through the slides. But I'll give you a little bit of an overview of Rosa. Some of the foundational work we've done as a board and as an organisation to really be more intentional about equality, diversity and inclusion in our work and programmes that we deliver, and give you some sort of two practical examples of the impact that work has had on the programmes that we deliver. One programme from Rosa, one from Homeless Link, that I hope will be helpful to you in your work. Next slide, please. So Rosa, as Amina said, is a UK UK-wide fund for women and girls tackling gender equality. So it's much broader than violence against women and girls, and really looks at and stands for a world where women are free from fear of violence, enjoy full health and well-being, and experience economic justice, and have equal and fair representation. So you'll see, if you've ever been to our website, we have some clear pillars across those 4 areas that our programs are delivered on. Through this particular, these pillars, we mobilise resources for women's equality so we raise funding and other resources to invest in the women's sector organisations through grants and wider support such as training and networking opportunities. We're also championing issues and funding for women and girls. And we also connect and convene organisations and funders to share learning, increase impact and build alliances. There's also a lot of collaboration that goes on to develop support for the women's sector. Next slide, please. So the approach we take, and I'll talk to you a little bit more about how we've got to this point, because I think some of the foundational work that we've done as a board and as an organisation has really informed this. So we use research, evaluation and stakeholder engagement to ensure our grant programmes respond to immediate, emerging and long-term needs. We have got clarity of focus on women and girls, but there is huge diversity in need, intersecting race, violence against women and girls, economic freedom, health and representation. So we really do actually respond to the diversity of the women and girls sector and address bias in our work. And I'll obviously talk to you a little bit more about how we do that. We engage in conversations with organisations. We actively seek feedback about our grant making, capacity building activities, research and the way we work. And we make equality of diversity and inclusion visible in the data and insights captured. So we identify key learning and actions that we take as a result. Next slide, please. So I'm going to talk to you a little bit about the work we've done as a board before I sort of mention what this slide's about. As a board, one of the things that Rosa during the pandemic, Rosa delivered a grant programme specifically for Black and minoritized-led women's organisations in partnership with IMCAN, which is the umbrella body specifically focused on Black and minoritized women and girls organisations. And through that, really identified the real need for funding in that sector. Of course, this was known, but this is actually something that we've got real insight from delivering this programme. And one of the things that Rosa did was to look at itself first. You know, what are we doing as a board? What's our makeup? How do we address equality, diversity and inclusion as an organisation? So one of the first things that they did was to open up trustee recruitment and actively and intentionally diversify its board. And actually that led to a greater awareness in the organisation of some of the gaps in our knowledge as an organisation around diversity. We also invested time in actually having training and support on what it really means to be anti-racist, not just being not racist, but what does it mean to us to be actively and intentionally anti-racist? And that actually really supported us as a board to think about our work programmes and to make sure that us as an organisation were delivering on that. We also did a lot of work organisationally on our strategic thinking, you know, our values, our principles, what we stood for. And one of the things that came up in that discussion was this recognition that as a board, you know, we can sometimes sit in either a high support, low challenge place. So we're very supportive of the executive team, but we don't really provide a huge amount of challenge. Or conversely, that we are a high challenge board, presenting quite high challenge to the executive team, but not providing much support. And that the actual real ideal place is that a balance between the two, so that we are asking questions, we are scrutinising the work that's being undertaken, but that we're doing so in a constructive and supportive way. So I'm going to go on and to give you some specific examples of how this work that we've done has led to some changes for Rosa, but also on one of the other programs I've worked on. So if I ask for the next slide, please. So the first example is learning from the Black minoritized COVID-19 Women's Fund and its role in the development of the RISE Fund, which is recently closed. So as a result of the work undertaken on this fund, we were able to identify some clear gaps in the support for the Black minoritized women sector organisation. We also were clear on defining what being a user-led organisation was and what being a Black and minoritized-led organisation was. So by defining these terms and understanding what we meant by those, we were able to start measuring our performance and our reach into these different communities. And in doing so, we identified that we are receiving a lot of applications from Black minoritized women's organisations. But at that point, they weren't necessarily making it through into being funded. And so by capturing that data, understanding what our definition was of Black minoritized-led organisations and what user-led organisations was, we were able to determine where we were falling down. And that then led to us identifying, to going out and speaking to women's organisations. This was a process that was around, first of all, learning from this programme who we were able to support and who we weren't able to support and why. This then led to greater discussions to gain stronger insight into what the barriers were. And for a lot of, because Rosa really supports grassroots women's organisations, for a lot of those organisations, they were firefighting all the time, meeting the needs and the rising needs of women and girls in their communities, and didn't have time really for longer term strategic thinking and organizational development, which kept them in this sort of cycle of firefighting and piecemeal funding. So as part of the process of gathering this intelligence, we also formed a working group of the board of all Black and minoritized women to start to think about what was our next programme going to look like and who was it going to target and how would it be designed. And in doing so, we created a critical friends group, which was of women's organisations themselves. So a very participatory process that really spoke to women's organisations themselves to identify what kind of funding is going to support you best. How can we create a programme that's going to meet your needs? And through that process, we were able to develop and fundraise for the RISE Fund. And I'm really proud of the fact that over 7 funders have contributed to that fund, and we've been able to put out for application for over an £1 million fund, which is fantastic given that we're reaching out to small grassroots Black and minoritized women and girls organisations. So that's I think a really good practice example of how, by looking for the gaps in your looking for what your gaps in your information, what you're not seeing from your current data, specifically understanding, defining your terms. What does Black and minoritized-led women and girls organisations mean to you, and therefore understanding where you're not meeting need, and then creating a process that is participatory, informed by women's voices through led to a programme that is going to meet the needs of the women and girls sector through the RISE Fund. So, and then the other example I wanted to talk to you about, which was during time at Homeless Link. One of the things that I think I think Amina actually mentioned at the beginning of the talk was about how data is captured and used really impacts what you can see and the visibility of different issues. And one area of that's really true is with regard to women's homelessness. When I first started working at Homeless Link, we were running a program called the Homelessness Transition Fund. And at the time, the national sort of rough sleeping statistics were collected gender blind. There was no breakdown between gender on how many people were sleeping rough. One of the parts of the program was that we would often get monitoring back from frontline organisations who were awarded grants through that fund. And through our review of that monitoring, we started to pick up a pattern of frontline organisations identifying that they were seeing more women coming through their services, that they found that the women were experiencing much more multiple and complex needs than the men, and that they did not feel well equipped to support women. And this then led to us realizing that actually we've got a real gap here. And so what we did over time was to start to build the evidence base. We started asking specific questions about women's specific needs, women's reasons for becoming homeless, putting forward a case to the government that we needed to see rough sleeping figures broken down by gender. We started asking in our annual review about training needs of organisations and specifically asked about women. Do organisations need training and support on supporting women? And this over time led to the creation of much more visibility of women's specific needs and reasons for homelessness. Many women become homeless due to domestic abuse and violence against women and girls. And this was something that was known anecdotally, but now we had the evidence base to back that up and to start to work with frontline services on increasing their gender and trauma-informed response to women. And that then led to the Ending Women's Homelessness Fund, which funded 29 cross-sector, women's sector and homelessness sector projects to really start to kind of look at how you would deliver gender and trauma-informed services to support women. So that's just another example of like how what you collect, what you look for, what the questions you're asking can really make a difference to the visibility of equality, diversity and inclusion in your work. Next slide, please. So just some areas for consideration I hope will be helpful. So, and were helpful to us, which was to support the development of a monitoring and evaluation framework that is participatory, like the example I was giving you about Rosa and the RISE Fund. So invest in evaluation and ask questions. So support investment in a database. It's so really important. It's so very important to have some kind of database where you can capture the data, that you can run reports, that you can really sort of see patterns. It's very difficult to do without that. So investing in a database and systems in order to more routinely capture data, learning from programs and service delivery. Consider some key ways to break down your data to make equality and diversity visible, so by ethnicity, gender, age, etc. And, just an example was, application broken down by demographics, made visible how many applicants were from diverse-led organisations, and then how many of those were successful in receiving funding. And that enables us to monitor that and to actively and intentionally change that if it's not good. So that's some areas for consideration, and I think that's probably brings me to the end of my presentation, but very open to questions. Thanks very much.
Thank you so much, Lisa. That was really, really helpful. I'm just going to see what questions we've got. I think for myself, I really found the model you offered around finding the balance between being a board that's, high support and low challenge versus, high challenge and low support really interesting. And I think also your point about, really exploring where the gaps in your data are and thinking where, you might not be meeting need. And I was wondering if what your experience has been, around prioritization. So if an organization does, seem to find that there are multiple gaps, in terms of like different groups they're not meeting needs for, how they kind of work with that prioritization, I guess. We all know that people, feel challenged in terms of resources and resource allocation and being able to have those conversations about, meeting those needs.
Yeah, I have to say that I think the work we did as a board, actually, where we had facilitated conversations around what it really means for us to be anti-racist and to really consider how, if we're an organisation that stands for tackling inequality and achieving gender inequality, then we have to do that across the board. So I think the key is to get your board on board, if that makes sense, to really kind of like allow those conversations to take place. I think sometimes they do need to be facilitated. We had a fantastic facilitator, Dr. Roberta Babb, who really supported us as a board to really consider these issues and to prioritise them, and helped us all to get on the same page as an organisation and as a board to do so.
That's a really helpful suggestion around, the role of facilitation and bringing people in. I can see that someone just had a quick clarification question, which was whether the government is now publishing the disaggregated statistics on homelessness gender difference.
Sorry, yeah, I meant to say that. So since 2016, they now publish disaggregated data on gender differences in rough sleeping figures across the country. So,
that's fantastic.
Yeah,
it's a brilliant result. Okay, thank you so much, Lisa. Okay, so I'm going to introduce our next speaker for this afternoon. Sanyukta is joining us also to speak on this topic. She is a planning, monitoring, evaluation and learning consultant from South India, but based in Barcelona. She works with networks, donor organisations, intermediaries and non-profit organisations. Her consultancy work involves advisory support, building expertise and workshops on key PMEL skills, like how to build a theory of change, mixed method data analysis and storytelling. Sanyukta particularly uses participatory, feminist and decolonialised approaches in her work. Her focus is on championing diverse perspectives and bringing human voices and our passion for social change back to our work. She also works on building sustainable M&E systems so that smaller organisations, as well as larger ones that don't have the dedicated resources, can still analyse their impact data and really carry out more meaningful projects. So without further ado, I'll hand over to Sanyukta.
Thanks so much, Amina. Hi, everyone. I'm Sanyukta. Lovely to have you all and speak to you all today. So one of the things that I'm going to be discussing today is the role of how you can embed DEI not only in your M&E practices, but in your organization culture just generally. So as I wait for the slides to come up, I'll just tell you a little bit more about why I do what I do. So the whole purpose, okay, well, there you go. So that was going to be my introductory moment, but we covered that. So I believe that a lot of the things that we do in M&E relates to what is not working anymore in development right now. So we continue to do things and projects and design work based on how we've been doing it for decades, and that no longer works. And so slowly now, as we're bringing in more diverse perspectives and bringing in more equity, I see a lot of things that line up with the approaches that I use, which is participatory, intersectional feminism, and a decolonial perspective. The last of which I'm going to be speaking to most today. And so I want to look at really how your organizations can work better with your trustees in doing not only your M&E work, but also all of your projects, and how you can embed these approaches in both your M&E, but also in your organizational culture. And so if we move, thank you. So one of the things that that I really want to clarify before I begin is that I did work for a while in the UK, but I'm obviously I'm Indian, so my language is slightly different. So I purposely do not and refuse to use the word charity because that's not the word that that connotation is not acceptable anymore. We're not beneficiaries and wonderful people that are giving the less fortunate from our largesse. And I dislike the power imbalance that is inherent in that word. And so one of the first things that I always begin with when I work with an organization is to discuss how and what language they use to talk about their work and their M&E. So just as a heads up, I might wind up using the word board instead of trustees, but I do mean the same thing. And I will not be using the word charity because I see them as either organizations or grassroots groups or communities. And I believe that one of the principles of using DEI approaches in your work is to really think through in a very meaningful way about the words that we're using and the terminology, and to not call your people beneficiaries, end users, stakeholders. That's too corporate. It's dated. We're living in a world where we're humans. And so they are your communities, they're your people. And so within that, let's go at what a trustee can actually, or what a board member can do to support your organizations. And they can, as Lisa was saying, it's more working in the way of a supportive partner, as a thought partner. I worked for 5 years at the Open Society Foundations, and one of the most broken ways in which philanthropies still engage with their board members is that the board members only ever speak to the executive, senior management, the program managers, the decision makers. They don't often speak to the actual people doing most of the work, and that again is a power imbalance that isn't working anymore. Then on the other side, you have the organizations or the philanthropies themselves seeing their board members as these glorified beings that they need to be, they need to have perfectly polished reports sent to them only once a year, that they're not really let behind the curtain to see how the organization works. So to the trustees that are in our audience today, I would say, please encourage the organizations that you volunteer for to introduce you to the support staff, to meet the rest of the team, and try and speak with them more regularly during the work year and the project cycle. Thanks, Emma. And just to make sure that, that you're engaging as much as you can with the actual work, because you'll hear a diverse range of perspectives and experiences that way. Very quickly, going back to what I spoke earlier about language, I wrote a development language guide, which explains why I stopped using the problematic words that I don't find valuable anymore. And to me, it's not just a question of slowly switching something and being more PC, because the words that we use do inform heavily the way in which we see the world. And so if we slowly start to look at them not as stakeholders, but they're like your communities, they're your partners, you then also start to balance out, like that visual that Lisa shared, you're balancing out that relationship a little bit better. And then here I also want to talk about the distinction between equity and equality. And so it's something that a board member should be aware of, the power dynamics and the systemic imbalances and discrimination that exist in all NGOs specifically. Corruption is rife. And so to sidestep that and to specifically target through using an equity lens, specifically try and speak with the marginalized people in your organizations, the young women, the minority groups, the gender non-conforming people. Absolutely, Rose. I will send you that language guide in a follow-up message afterwards. I have it as a PDF on my website. Thank you, Nicola. So practically speaking, that's one way that we can sort of decolonize the whole experience, but also bring DEI very much into organizational culture, because I think that if you embed it that way, it becomes a more sustainable and a long-term way of thinking about the work that we do more broadly, of which M&E is a small, significant part. And one of the big issues that we also see within M&E specifically is that organizations often will contract or target the same evaluation groups or consultants, oftentimes ex-employees. I know this because I've done it at OSF myself. And so what that then does is that you have the same people over and over again that might be using the same methodology. So you have, you're not innovating in that aspect, or you're having people that you know well who are likely to tell you what you want to hear. And so bringing in DEI into that perspective is opening up the practice to specifically target and explicitly mention, that we are only recruiting firms that have a DEI culture, or we will only target women-led. Thanks, Julia. We will only work with women-led evaluation firms. Specifically in the UK as well, because I know many of our audiences there, and I lived there also for a long time. UK NGOs, please remove the UK visa requisite from any TOR that you're sending out to evaluation consultants. By automatically discriminating against those who don't have a work visa to travel to your head offices, you're missing out on the opportunity to work with a wonderful group of evaluators from across the world who are not going to have the visa necessary or the money to be traveling to London to speak with your team. And I'm still seeing, unfortunately, these TORs, even after the pandemic, which has proven that we don't need to be in the same physical space to work together. And that also does a lot to redress the power imbalances. That is something that a board member or a trustee can do, is to get involved with the recruitment process for external evaluations for any M&E consultant that you're bringing in, and to ask them, let's discuss how we can move this into a more DEI approach. So now that's out of the way. Let's move forward. I want to get into some controversial topics. Thank you. Okay, so I look at 3 possible ways in which you can work on the relationships with your board, and I'm mindful that we're running a little low on time. So I'm going to go to the third topic, which is the most interesting to me first. So the third one is to look at the history and the role of colonization in your organization. Let's all be frank, if we're looking at UK-based NGOs, this is something that we really do need to reconcile with and be very honest with each other. For example, one of the hosts of this event is the Clothworkers Company. Now, the Clothworkers Foundation from the Clothworkers Company does do charitable work. However, its trustees do have a duty to ask questions and to be honest and transparent about the role of the Clothworkers Company and its part in colonization. The Clothworkers Company has been around for 500 years, and textile and exploitation of cotton and textiles and indigo was one of the most exploitative and brutal ways in which the East India Company colonized my country, India. Members of the Clothworkers Company were also founding members of the East India Company. So if, as we've seen with Oxfam, just by virtue of being an organization or an NGO, you are not exempt from corruption, from being part of the system, from taking a role in perpetuating power imbalances and exploitative dynamics. And it is the responsibility of anyone who's working in those organizations now, who is a part of a trustee membership or a board member, to take a step back and to evaluate what that history has done to the way that the organization now operates. So trustees of museums, for example, the Victoria and Albert Museum or the British Museum, if you read the placards, it would look as if British people went for a 300-year holiday in India and were exchanging diamonds like postcards. What we need to do is restorative justice, and we need to begin from a place of acknowledging and apologizing for our organization's complicity in our exploitative history of colonization, to call it out, call a spade, and to go forward to deliberately redress that. So specifically organizations that have this history, Oxfam now needs to make extra efforts to be gender and feminist sensitive, and to work with a properly intersectional approach, and to do sensitivity training for its HR people, for its staff, for example. And so these are things that we need to start addressing in very tangible ways. So that's the first one that I really wanted to make sure that we could have some time to discuss and really unpack, even though it's uncomfortable. We need to be very clear that this is, there's a fantastic book called The Radical History of Development Studies, which discusses how development studies came out of the colonial period. It is only as old as the 20th century when colonies were gaining independence. And so people who were colonizing officers became the administrators of development departments and foundations. And that thinking carries forward. And since we have not changed the way in which we do projects or necessarily the ways in which we think about our work, that kind of mentality continues to this day. And that needs to be something that we really redress. So to the other 2 points that I was discussing, one is transparency and the second is accountability. Within the role of DEI and transparency in your M&E approaches, we need to also be looking at feedback loops in a more open perspective. So specifically when you're doing an M&E project, to bring in a DEI perspective would involve something like, since you're extracting knowledge and information from your communities and from your people, the feedback loop should also go upwards to your board, if you were to look at it that way, upwards to your board, but then also downwards to your communities and to share with them, this is the output of us coming to you for several months of the year, asking you questions, interrupting your day. But here's what we've done with it. We've put together an evaluative report that shows us where this project was successful, where our strategy is working and isn't. And here's a way in which we might change to make it more equitable to you, more meaningful for you and your work, and more impactful for your communities. What do you think? Because what we often do is we will put together a portfolio review or an evaluation report or a strategy document analysis, share it with our board members, discuss with senior management, and then get those approvals and then continue. Whereas actually what actually matters is to be open and transparent with your communities and to get their perspectives. And that links obviously very strongly to accountability, to look at the role of a participatory and truly inclusive M&E, and to see that your communities have to be deeply involved in evaluating your work as well, because they have to evaluate your own role in them and in with their lives. And so you are accountable not only to your board members, because you need to make sure that everything that you share with them is in line with your organization strategy, that you're working on budget to get your approvals for the following year, but you are ultimately accountable to the people for whom you work. And so the questions need to go both ways, and then you need to be regularly asking yourselves these reflective thoughts. So that's a lot. So I wanted to, before I move to the next slide, could you quickly tell me in the chat window, because I have it on my other screen, which of these resonates with you, what makes sense? This could either be something that you currently do or that you would like to do in the future. Let's just take a couple of minutes, and then I'll next move on if we have time. Someone could let me know if we have time to move on to the next one, but probably stop.
Oh, Sanyukta, I think we've got maybe 2 to 3 minutes, so it might be more
fine.
summing up.
Let's go to Q&As then. I think, yes. Wonderful, Nicola. I'm so glad to hear that. Absolutely. It's to look at who is it that you are most, at the end of the day, you're doing a project that is relevant to communities and to people. And so those are the ones that you have to be the most accountable to, right? So to look very clearly at whether you're making a change in their lives or not. Were there any other questions or thoughts or discussion points? Otherwise, I can move ahead a little bit earlier, because I did have a lot on the concept of power, but I think
what we can do is we've got a sort of full Q&A at the end, so I think we can kind of loop back. Yes, so I think any kind of questions that we don't have time for this moment, we'll come back to.
Yeah, that's great. Okay. Thank you.
Fantastic. Okay, thank you so much, Sanyukta. these are obviously really important topics, you know, everything about the language we use to, you know, the history of our organizations and the kind of upwards and downwards accountability that we all have. So we have one more speaker for this evening, and then, as I mentioned, we'll have a full Q&A at the end where we'll be able to delve into some of these really important topics in a bit more detail with our speakers. So we'll be hearing from Tony next. And I'll just quickly introduce him. Tony is coming to us with over 30 years of experience, mostly working within the voluntary and public sectors. He's had a background in work in youth work, homelessness, and community engagement. Tony is also a trustee for Groundswell. We'll be hearing more about that this afternoon, and also for People's Voice Media. At the moment, Tony is also working as a senior participation officer at the Joseph Rowntree Foundation. Prior to this, he worked at Crisis UK as their member involvement coordinator, and also at Hackney Council in the past. Tony's also a citizen social scientist and a member of the London Prosperity Board, and he has experience as a participatory facilitator. So we'll be getting some more in-depth and detailed information from Tony about how we can bring these approaches to our work. Over to you, Tony.
Wow, thank you very much indeed. I feel I'm taking up space, such an esteemed panelists. I really could have listened to both speakers for a lot longer. I'm going to try and whiz through a lot of what Lisa and Sanjukta was talking about in terms of why do we invest? Why do we care about this? Why is equality, diversity, and equity so important? As said, I'm a trustee of two organisations, People's Voice Media and Groundswell, as well as being a citizen social scientist, and also a member of the London Prosperity Board. I came into research through my own experience of homelessness. I was asked a question that really bothered me, and that question was, do you care about your local community? And I found that when I was writing the answer to that question, I hadn't really thought about why I cared about my community, or why I cared about the voices that are often ignored, not so much unheard, but no action taken. But let me come back to that. So let me try and take you in a more coherent way about my journey. So I've got over 30 years of lived and learned experience of working in the voluntary sector. And that lived and learned experience has both informed my approach and my practice, really. I'm currently, since this, I've currently moved on to do some work with Engage Britain as their Reconnection Tour manager. And as previously said, I work for Joseph Rowntree, Crisis and Hackney Council. I consider myself as a participatory facilitator, and that's something that both of the previous speakers spoke about before. Lisa spoke about, as a board, the importance of working with rather than doing things to or for people. And when we have that approach of working with, that's when things start happening. When I was homeless, I joined Groundswell as one of their peer researchers, and I'll tell you a bit more about that as I go through my presentation. And I joined, I got trained by them. I learned how to set the questions, the difference between qualitative and quantitative. And that was over 10 years ago. And today I'm now one of their board members. And this is the power of, or one of the impacts of working with people rather than to or for people. If we could move on to the next slide, please. Thank you. At Groundswell, we're working with 4 issues: homelessness, health inequalities, and lack of participation. And also we believe that unless the society works for the majority of us, it's not working for any of us. Let me just go back to homelessness for a minute. We believe that everyone has the right to a safe home and to contribute to society. However, an estimated 320,000 people are experiencing homelessness in the UK. When we talk about homelessness, there's no single definition of homelessness. And some people can argue that's by design. So it's a harder number to do research on. And there's many definitions of homelessness, from street homelessness to intentionally homeless or living in temporary accommodation. So when I'm using the word homeless, I'm thinking of it in a widest context, not just as defined by local authorities. Anybody whose accommodation is not secure and is at risk is in a form of homelessness. Homelessness increases puts a strain on the NHS and our wider society. So why are we not addressing it? Why are we not putting, and over the lockdown, we saw what happens when we take away some of the barriers, such as local connection, or have you got a claim going? During lockdown, the government ran something called Everybody In, which basically said everybody who was sleeping rough, we were going to accommodate them and sort out their accommodation and everything else. In fact, the government ended up breaking the law by doing that and had to write law retrospectively. But the important thing here is that they responded in a way that for years and years and years, grassroots organizations, charities have been asking them to respond. And they've rolled back since then, and there were some issues with it. There's really good practice around housing first that is beginning to develop and take more root around homelessness. But when we look at the cost that is costing us to keep it going rather than address it, it beggars belief. In terms of health inequalities, everyone at Groundswell, we believe that everyone has a right to good health and a right to access healthcare. However, if you're homeless, to get access to healthcare services is very, very difficult. And this is something that we've campaigned about and we've really brought to the fore. For example, that homelessness results in deaths of people, the homeless population. They tend to die 35 years earlier than people who are not homeless. And the average age of someone who's homeless is just 44 years. 44 years is the average age of somebody who's had long experience of homelessness. In 2018, 2 people experiencing homelessness died every single day in England and Wales, and many of these was preventable due to health problems. So when we talk about health inequalities in relation to homelessness, what we're literally talking about is the loss of life and the risk that this brings, as well as the amount of money that just is in all of this. I'm going to spend a little more time on the lack of participation, because the 2 previous speakers spoke about the importance of the participative approach. And it's really, really important. And this goes back to the working with people rather than to or for. People with experience of homelessness should inform the solution because they know the problems. And the reality is there's a lack of participation when it comes to designing services and policies that impact on people's life. So many of the services are designed to or for people rather than with. We need more lived experience involved around the table, being part of the decisions, talking about the reality of what works and what doesn't. I'll give you a quick example. When I was homeless and I was doing some voluntary work for a charity who was working with homeless people, they moved into new offices. And I remember there was a conversation in the office where they were talking about this type of bookshelf they could buy to store our files on. And I said to them, why don't we just store our files in the crate, and you give me that money and I'll go and buy some underwear, because that's what homeless people need. They don't need a fancy office with fancy filing system. They need things that are very difficult to wash, and you know, underwear is key, especially for street homeless women and men. And when I said that, we stopped and we really began to look at what kind of service we're providing, in terms of, was it meeting, were we expecting homeless people to meet the needs of our service, or were we trying to meet the needs of homeless people? So the fourth point, a society that doesn't work for everyone. The system has been designed, and the previous speaker spoke about some of the intersectionalities and some of the historical context of a lot of the restrictions to opportunity for everybody. Poverty restricts people's options. Pressure from high housing costs, inadequate housing, poor mental health, all of these things impact. And homelessness can, there's often people say, do these things cause homelessness, or homelessness affects this? When these things happen, the risk of people becoming homeless and long-term homeless just increases. So what we need to do is that redesign. We need to rethink how we providing services, who should be involved in providing those services, so it doesn't just work for the few, but it works for the many. Could we have the next slide, please? Thank you. Our core beliefs at, this is our core beliefs at Groundswell, and this is really important because when, whatever situation the board is dealing with, whenever there's a crossroads or a difference, or even when you're doing recruitment, you've got to come back to your core beliefs, your mission. What were you set up to do? What is the values? What underpins your approach? So we wholeheartedly believe that the whole community benefits when we effectively tackle homelessness and social exclusion. We believe that people are society's most valuable resource, and everyone has the capacity to make a contribution. Some contributions are different in size, but everybody should be entitled to contribute, and that contribution be heard, valued, and respected. There's no them and us, only us at Groundswell, and that's something that is never fixed. We are constantly trying to level that playing field, reduce the them and us. I was having a conversation with one of my fellow board members today, and we were talking about how when we encourage people with lived experience to come on board or get involved with services, we can't just say, come and join us if we don't have the support package in place to support people. Because when we use terms like lived experience, that's not just a term of yesteryear, it's a term that lives with that person forever. And at different times, it will surface, it will come. So what sort of support are we putting in place, do we have in place, if we want people with lived experience on our boards, if we want people with lived experience making decisions, what support do we have in place to nurture and guide that? And at Groundswell, our fourth core belief is around participation. Let's involve everyone. Let's support people to participate fully, because it creates more effective services and policies that crucially enables people like myself to move out of their homelessness.
Tony, I just wondered, we've just got 2 to 3 minutes left for your section, but I would really love people to hear about the peer research methodology, which is your last slide. So I was wondering if you'd be open to jumping over to that. Would that work?
That works perfectly. Yes.
Fantastic.
Please.
Okay, we'll just skip ahead to peer research methodology. That's the final slide.
Okay, thank you. So no, the next one. Yeah,
that's it. Yeah.
So when we get paid researchers at Groundswell, one of the key requirements is that whatever research that they're carrying out, they need to have lived experience of. And as I said before, part of my journey out of homelessness was as a peer researcher, and I was doing some work around the impact of the HRA, the Homelessness Reduction Act, because it's a longitudinal study we were doing over 3 years, and we wanted to see, has it made any difference? Is it making any difference to homeless people? Our approach really is to work with the individual and get them to the point where they feel able to become a peer researcher. So this often means that we have to invest in supporting them, invest in training, and working with people who are sometimes still leading a chaotic way of life. And what happened for me in my journey through becoming a peer researcher is that through gathering things like real stories and the insights, it made me realize the distance I'd traveled in my own journey. And all of this is building blocks of self-esteem. It's all building blocks in how we start to feel better about ourselves in order to help others. And I can't tell you how many times other people that I was doing research with have said to me, how can I do what you're doing? How can I get involved? Because there is a power when you've been not listened to, when people make a wide mark around you, to suddenly where people are saying, what you're saying resonates with me, what you're saying relates to what I'm saying. And for me, in closing, what I want to say is that when we do our research at Groundswell, and we will send links out because we've got many products at the end of it, sometimes it's a report, sometimes it's about creating new resources. If you haven't seen our film, do have a look at the website. We've got 3 or 4 films, but the film that momently slipped my mind was Clarissa. Do have a look at that film. It's very, very powerful in terms of the insight into homelessness from one young woman's point of view and some of the difficulties that she found. But in closing, what I will say is that peer research for me was what moved me or helped me along my journey from homeless to where I am. And to be a peer researcher at this stage, and then to be sitting on the board and helping the organization with its strategic governance, is something that at the time I would never have imagined. And this is what can happen when people work with people rather than 2 or 4. Thank you very much.
Thank you so much, Tony. Lots of stuff for us to be thinking about as we move into our kind of wider discussion and questions. So I'm just going to start with a question that thinks about the fact that some of the DEI practices we've been talking about today, involving reflection, education, building trust, reflecting on power, relationships with communities. How can staff and trustees and other senior leaders sort of marry the time it can take to do this type of work and really invest in it, with a sort of a sense that organizations can have around needing to keep up with reporting tangible results. So I guess it's that kind of balance between this is a process that takes time, and there's sometimes, a strong call for seeing tangible results quickly. Anyone's welcome to jump in on that. Go ahead, Tony. Yeah.
Controversially, I'm going to say push back, because pushback, because think of it like building a house. You don't start with the roof. You have to start with the foundation. And the foundation, what we're talking about is relationship. Everybody bangs on about relationship. Relationships take time. If I went up randomly to somebody in the street and I said, give me £1, they probably would. If I said, give me a £5, they'll look at me sideways. So I said, give me a £10, they certainly won't. To get it, that takes time. If I've got to know that person and we had a relationship and I needed that, and I said to somebody, could you lend me 50 quid? They would lend me the 50 quid built on that relationship. So push back when people, funders, whoever are saying, we need this yesterday, say, then we're not the right ones to provide it for you. I'm really sorry, because we value what we do. There's a process, and that process is where the magic is.
Mm-hmm. Did you want to add something, Sanyukta?
Yeah, just super quick. I think, Tony, I think that I wanted to say something, but I think the last point you made was just so perfect. It's like you need to, yeah. Nothing changes unless someone is like, we're going to be the one that starts something out. No, we keep passing the buck, saying, and this was my role at OSF. I was like I was essentially in charge of portfolios, but I was not the ones making the grant decision. Very easy for me to say, well, I'm not the ones making the decision, talk to that guy. He'll say, talk to my boss. Boss says, talk to the board. And it's like someone has to stand up and say, okay, at some point I'm breaking this. So if we have trustees in our audience, you are in a position of power. So you go to your organizations, you go to your foundations and say exactly what Tony just said. If this is what you want, we're not the right person. This is our approach. Someone at some point needs to be brave. And this is something that no organization, no NGO can say that you're participatory, you're doing diversity and equity, unless you have this culture within you as a human and you're going to stand up for your values. We've all probably had it up to here with people who give tokenistic nonsense and they don't act on their words. I've been the token hire in places, OSF included. It's annoying as hell. So someone has to say, this is stopping. And if people in our audience are not trustees, if you're in a leadership of an organization, that's your position of power. If you're in, as I was, a support function, I had a relationship with my grantees. So that's my place. I'm bringing in that culture over there. I also was very lucky. I'm a good relationship builder. I had the chance to talk to some board members of my programs. So I would talk to them being like, this is not, we're making too many demands of our grantees. Reporting and M&E requirements are too standard. This needs to change. So not saying I'm super brave, but I did what I could because I know how frustrating it is to keep doing lip service and to have nonsense PDF sitting on clouds and it says the same nonsense over and over again. It just got super annoying for me. So someone has to be the young upstart.
Yeah, and I think it's something that people can only get better at if they do it. You know, you have to get the skill of challenge through, you know, actually putting yourself out there and doing it. And I think the last thing you were mentioning there leads on to another question we had, which is around, you know, this balance between inclusivity, so involvement, but also, like you were saying, about how much burden we're placing on the people that we're collecting data with, and that's always a consistent challenge. And what are some of the things we can be thinking about when it comes to that? Lisa, go ahead.
I was just going to say, I think part of that is how you go about collecting that data. I think some of these ways in which we do this are quite faceless, quite you know, sort of neutral. But actually, if you're taking the time, as Tony and Sanjukta have said, to build these relationships, to get to know people, to kind of build that trust, then actually the insights and the, you know, the sharing is much richer, and you gain so much more knowledge and understanding. So I think we really need to think about, what does participatory really mean, and how do we do it in a way that's not onerous on the people we're working with, but also they feel like they're really contributing to change and they can see that change happening.
One more thing, I mean, and this relates to what Tony was saying about pushing back. So we need to, before we begin with asking the same questions, going out and doing 15 survey questions, ask to what purpose? Who are we writing this for? What is the need? what is the lowest that we can get away with asking the communities and making impositions on their time and their resources. And if it's like a fluff piece for the board, or it's a fluff piece for literally anybody else, then do as little as you can get away with. If it's a thorough evaluation, like you're doing a 5-year strategy review and you are committed to changing your programs in light of what you discovered, then you have the room to do a proper data methodology. So begin with the why and then you go backwards always.
The only thing to add to that, to this beautiful cake that we're making here, is to make sure it's not transactional, right? So much is take. And exactly, why are we doing this? Who's it for? The question was asked earlier on about key stakeholders, and that's who always should be front and center. And that's why earlier I was saying you've got to come back to your core values, your core beliefs, because that we don't just have them for the sake of having them. Those are the pillars, those are that foundation I was talking about, and then everything moves forward from there and flows back to there.
Absolutely, thank you. I wanted to bring in a question that we had earlier in the afternoon from Nicola, which was about, you know, this sense from people that, you know, need to be collecting the data and are kind of working in the space of, how do you deal with that sense of overwhelm in targeting data collection and trying to kind of balance that need to collect so many things? I guess, Sanyukta, you might have some thoughts around, I guess, when you're supporting people with MEL.
I do, but I want to let other people talk. But it's really, it's what is, I always like to think like, what is the least amount of knocking on people's doors and bugging them that I can get away with? And one way that you can reduce the overwhelm, and this is, which I really advocate for my clients to do, is to try and have like multi-purpose data collection points. So if you're going to your community, if you work in a rural area, take you know, an ethical photographer with you. I run workshops on ethical storytelling. These are not faceless, nameless brown and black people. So when you're going there to bug them and to take photos of them for your social media, get their names, get their consent forms, use that time to ask them questions that are relevant to your project. 2 birds, several stones, or whatever the expression would be in this context. But, you know, try and do that. Like, minimize the site visits, minimize that. And if you must go, try and get at least a few things knocked off your to-do list with one trip.
Yes, Tony.
As a cautionary note, I say before you go out, look at what data you're collecting. Like, that comes back to the why you're collecting it, who's it for. That comes back to some of the pushback. That comes back to what Lisa was saying. If you don't collect the right data, you won't have the evidence to support what you're trying to support. So streamline it to what is, if I was going to offer a framework, what is essential? What can I not have? What is important to me and what is nice to have? Yeah, but having front and center what is important, and when I say what is important to me, what's important to me as the organization, to the beneficiaries, rather than just people we're writing reports for or funders or whatever. And some of the pushback is to say to them, we collect this data because this is important to us. This thing that you're asking for sounds lovely to you, but actually this is the reality of our work.
I think something else that would be quite interesting to reflect on, because so much of what we've been talking about today has been about kind of, you know, approach. And I guess it's useful for us, people that are here today, trustees and people from other social organisations, will probably be trying to think about where their organisations are in this process and where they fit. How would you think about characterising the key differences in mindset between organisations that are putting DI at the centre of their evaluation and people that really aren't applying those principles or finding it's not working for them? Are there kind of differences in mindset that people can identify in their organisations? Lisa, please.
Sorry, yeah, I think this is a really fundamental one. It's a real culture shift for organisations, and they really have to invest in doing that work organisationally, because then it's not a tick box exercise. It's not some tokenistic kind of, we'll just put these in place and this is going to make everything better. It's an actual shift in perspective, perception, culture shift that makes that what you're doing meaningful. So I think there is this work that needs to be, this culture shift and this culture change needs to be invested in as organisations.
One more thing to add, and also to make sure that DEI is not HR related, related to what Lisa is saying, but just make sure that if you go to an organization and you ask them, what are you doing for DEI? And they point to your brown women, no. So it has to, those days are not gone, they're sadly still around, and it's, you know, very familiar for all of us. And it's do you understand what that actually means? Is everyone in your organization privileged? Because OSF and many foundations have, might have people that speak different languages, but everyone has at least one university degree. Do you understand what diversity actually looks like? Do you have an understanding of what equity and equality are? What are their differences? Otherwise, go on a proper training. I can share fantastic DEI trainers who actually do the real stuff. And we can add that to the resources if organizations would like to do that. The resources that we share around with people. No lip service. Yeah.
Wow. That culture shift, a bit like working in the participative space, is sometimes messy. Okay. And what we need to be aware of is that often we talk about safe space. Safe space keeps the system exactly where it is. What we need is brave space. And the difference between safe space and brave space is that in that brave space, we could say the things that makes people stop and think, not the PC right on, not the things that people feel comfortable with. That brave space takes time to build. And it has to be handled sensitively. And I feel really privileged that there's a few organizations that I'm working in that are doing that. And it's work that needs to be constantly given attention to. It's not something you've ever done or achieved. It's work, it's continuous work in progress.
It absolutely is. And I think about this fact that it is continual work in progress, and people may have to do a continual pushing back. And considering the journey that this can be, what are some of the signs that people can be looking out for in terms of progress markers, you know, a sense that you're kind of on your way, and you know, ways of seeing that you're moving in the right direction? I think it can be hard for people to feel like they're making progress with some of this work.
I think one progress marker that I've experienced and witnessed is where, if you are as an organisation undertaking that work on really, you know, making that culture shift happen, exploring and creating that brave space. Tony, I love that. Creating that brave space is one of the markers I see, is where people start to talk more freely. They start to share more freely, people being heard. It's not a threatening thing any longer. It's not a, you know, oh, I better not say that, or I'm scared to share this because, you know, and it's actually where people are able to bring their whole selves to work rather than bits of themselves. We're actually celebrating each other's difference and diversity and utilising that as our strength. So I think one of the markers for that is for starting to see people share more.
Mm-hmm.
Also, I think it's something you said earlier on, Lisa, when you collect your data and you start saying, where's the gaps, what's missing, why have we, all right, I'm getting confused, or where we say things like, so X amount of people from Black and ethnic minorities have applied, but only certain people have gone through. Interrogate that, look at that. Those are progression markers. And when we start doing that, as Lisa just said, that's when we know we're able to move into that brave stage to say, actually, things are not hunky-dory. There is some gaps in our knowledge. And that's what I mean about it being continuous. But the more we do it, is the less difficult it becomes. We just get really used to keeping ourselves in check, and everybody keeping ourselves in check. So the gap between the board and employers shrinks because the organization is really one. It's like a team. People have got different roles to play, but the objective is the same. You know, if it's football, it's about getting more goals in their goal than they get in yours. You know, but everyone's got a role to play. Not everyone could be the striker. Not everyone could be the goalkeeper. You know, there's positions and. All right, let me stop with the metaphors, but
I like that thought about you should be able to see people coming closer together rather than feeling that, you know, the void or the distance is getting bigger and bigger, you know, as we go along.
Yeah, I was just having one thought. The approach of opening up spaces and making people feel in a certain way may or may not be culturally appropriate everywhere that we work. So let's also be clear that this approach that we're discussing would work and is important in the UK. I'm Indian, and this approach to DEI, using words like safe space, brave space, will not go down well in certain offices in India because there's a different approach to being equitable there. It looks different there. We need to discuss class before we discuss gender in India, for example. You know, so that's also something to consider if you're working in an international organization, to bear in mind that social norms and cultural norms will need to factor into which tactic you use first in your organization. Just.
I mean, I suspect we've just got a few minutes left. So I think rather than me necessarily jumping to more questions, it might be an opportunity for any final thoughts you'd like to leave people with. And then obviously I'll be doing some summing up and some closing actions myself.
I mean, what Tony said, really, you know, interrogate when you're finding gaps, when you're seeing things that are, if you see patterns of things happening, like we did with the women's homelessness monitoring reports. This isn't something we were routinely looking for. It was because we took the time to read what was being sent into us. We could see the pattern emerging, and then we started to interrogate why is this happening, what's different here. And this is what unearthed and made more visible what was going on for women experiencing homelessness, and how we as an organisation can start to build that evidence base. So, you know, look out for things, to speak, you know, build those trusting relationships with people and hear what they've got to say, so that you can actually make more visible and address the gaps.
Okay. Yeah. I think Tony or Sanyukta, if you have anything you'd like to say, please do jump in. Otherwise, I'll close. But yeah.
So in closing, what I will say is what I said before, that this work is sometimes messy. I will include an academic paper around brave space and safe space, because I think that would be useful for people. I think a lot of what we're talking about here, one size doesn't fit all. And that's a really important point you made about the cultural differences as well as the international differences. But what I think the point I want to leave people with is going back to one of our core beliefs, that unless we have people involved in the service design, the service delivery, the service evaluation, the services are not going to be fit for purpose. So let's move towards working with people rather than to or for people.
And maybe one very different point is also, let's look at our organization's culture and our organization and our country's role in history. I think that is something we very often skate by it. And I think especially, I mean, I'm going to make it awkward. I lived in the UK for 6 years. It's a very awkward conversation. Nobody wants to engage in it. Tough. You need to. It happened to my country in recent memory. It's very personal to me, and it's not just because of that. It's justice. It affects the systems that are currently in power. It affects, you know, the organizations that are currently running the world, including the one hosting this event. And it's amazing that we can sit here and say this, and that we need to discuss it very openly and say restorative justice comes from that place, about being honest about what happened, being transparent about it. You don't have to sit here and apologize for it, but you have to reestablish that balance. And that's where it begins. So if your organization's been around for decades, if it's a faith-based organization, interrogate it. That had its roots in colonization. That does not have a place in the 21st century anymore. Let's investigate that. So sit with the discomfort. It's okay.
That's the only way we make progress.
Absolutely.
Yeah, thank you all. So I'll just share some closing notes, and I think this has been such a great discussion. I think you've all shared insights that have given me great food for thought in my own work, and I'm sure it's also given, you know, perspectives and experiences that can be useful to everybody else as well. I think Lisa, particularly, her thoughts on how inclusive data can inform stronger decision making and more equitable resource allocation, and Sanyukta's reflections on history and the role of power, and Tony's reflections on the power of peer research approaches, you know, to help us kind of shift our organization's practice in more equitable direction. So then we've come to the end of the webinar. I want to give really big thanks to our speakers, to Tony and to Lisa and to Sanyukta, and also to, you know, appreciation to the audience for joining us this evening. Please do take a few moments to complete the feedback survey online, which my colleague is going to pop in the chat. As a reminder, we're also looking for people who are willing to take part in short telephone interviews about this seminar series. If you've already indicated that you're open to recontact, you'll be hearing from us. It's really important. It helps us to, you know, shape the future of seminars and make them even stronger for attendees. And last but not least, our thanks to the Cloth Workers Company for supporting what I think are really invaluable trusteeship seminars. And I hope you all have a wonderful evening. Thank you.